Welcome to the Idaho Main Street Podcast, where we talk about the issues that matter to you. We're excited today to have a person that knows what they're talking about when it comes to healthcare policy in Idaho, a senior policy associate with the Idaho Voices for Children. Is that right?
Yes.
It's a bit of a mouthful. Hillarie Hagen,
Yeah.
the one, the only. Thanks for joining us today.
Yeah, thank you so much for having me.
Yeah, we were just talking a little bit before. You've been doing healthcare policy for a long time.
Yeah, gosh, almost 8 years now, even before Medicaid expansion.
Yeah, and it's only getting hotter and more exciting.
Sure, I guess that's how you can say it.
That's one way to put it. We got to tell us a little bit about the organization, because a lot of our listeners probably haven't stumbled upon it.
Yeah, so Idaho Voices for Children has been around for about 20 years. And our whole mission is to advocate for policies that impact children and families in the state. So we're not funded by any federal grants or any sort of big donors outside of just individual donations, foundation grants, and we're a unique nonprofit in that we work on multi-issues that impact kids and families. So healthcare is my area, but we also work on child welfare and family economic security and food assistance issues and childcare.
Yeah. When most people hear the word healthcare, their stomachs turn a little bit, right? Because it's usually comes at a cost. It's also very complicated, and I check out sometimes when it comes to healthcare because it gets so messy, and I'm just figuring out the difference between deductibles and premiums. But you're in the weeds on this.
Yeah, healthcare is a really complicated topic, and Medicaid, as it relates to healthcare, is almost even more complicated. And so I've been in this for 8 years now, and I'm still constantly learning new things.
Yeah. Well, you're a subject matter expert today. The Medicaid policy is becoming a hotly debated issue in Boise with the Idaho Legislature. There's a bill at play that could have some interesting implications in Idaho, and we want to spend our time today sifting out what this means, but I'm hoping you can take us back to the beginning. Medicare and Medicaid get mixed up so much, and there's this common mistake. Walk us through what Medicaid is and who's it for.
Yeah, so Medicaid is very different than Medicare in that Medicare is very specific to seniors. And also, sometimes if you have a disability, you can qualify for Social Security disability before you turn 65 and you can get Medicare. Mm-hmm. But essentially, Medicaid is very specific in that it serves children, pregnant women, low-income adults through Medicaid expansion, as well as people with disabilities who are not seniors.
Okay. So a pretty vulnerable population.
Yeah, absolutely. So when you look at Medicaid, it is very specific on eligibility in regards to income or disability. And so if you have a kiddo who qualifies under Medicaid, you're making about 190% of the federal poverty line. So for context, that's about, for a family of four, it's about $49,000 a year.
Oh. And this is, people conjure up images when they hear the terms entitlement or welfare system, but it's not homogenous. There's a lot of different types of people that need this.
Yeah, so Medicaid was really designed to serve low-income populations, to fill the gap where private insurance is not able to be affordable for families. And so Medicaid really, when they designed it for children and pregnant women, originally people with disabilities, because private coverage oftentimes just doesn't provide adequate coverage for people with disabilities in particular. And Medicaid, back when it was designed, when they started designing it for children, they made it very specific to kids to meet developmental needs of kids, in particular, kids who come from impoverished homes or communities, because they tend to face greater health concerns from living in poverty and just fewer resources.
And the idea here is the government invests in Medicaid because without it, the cost would just it'd be more expensive later on, or somebody's got to foot the bill because sick people are still going to get sick.
Correct. So it's a state and federal partnership with Medicaid. So the federal government does cover the majority of the cost. So for the traditional population, so those are your kids, your pregnant women, people with disabilities, it's about 2/3 split. So the federal government pays close to 70% of the cost, and Idaho pays about 30%. For Medicaid expansion, it's a fixed percentage at 90%. So the feds pay 90% of the cost. The state pays 10%. And how it's different between Medicaid expansion and the traditional population is the federal amount that we get varies year to year based on how Idaho's economy is doing. But for Medicaid expansion, it's set in federal statute. So it literally takes an act of Congress to change how much the feds will pay for expansion.
And this might be repetitive for some of our listeners who followed healthcare policy, but I think it's important to understand the history of this, of why expansion exists. And we often hear this thing called the gap, and how the Obama administration played into this. So give us the historical context of why there's a gap and what expansion did to fill it.
Yeah, definitely. So if you go all the way back to 2012, the Affordable Care Act essentially changed our healthcare system and how health insurance was delivered to populations across the country. And they established a system where you can access private coverage and get tax credits, like advanced tax credits, to help cover the cost of private insurance. It also changed who could qualify for Medicaid under particularly the quote-unquote expansion population. So it essentially said that we are going to allow adults up to 138% of the federal poverty line. It's about $18,000 a year for a single adult.
Okay.
And then after that, if you make over 138% of the federal poverty line, you will qualify for these tax credits to purchase health insurance. People may be familiar with Your Health Idaho. That's our state-based marketplace where you can access a marketplace plan with those tax credits. But when this passed and when this became law in the country in 2012, the states pushed back on it and said, you cannot force us to expand our eligibility for Medicaid for adults beyond what it currently is. That should be a state decision. The Supreme Court said, yes, states, you are right. It is a state decision to expand Medicaid. And so what that essentially did was it created a gap for individuals in states like Idaho who did not qualify for the traditional Medicaid program. So you're looking at your people with disabilities, your children, pregnant women. There also was you could qualify for Medicaid under traditional Medicaid as an adult if you had a child living at home and you made no more than 26% of the federal poverty line. So you're like looking at $400 a month. And if you didn't have any children at all, you don't have anything. And then, so what we found was if you lived in this gap, you made too much to qualify for traditional Medicaid, but not enough to qualify for a tax credit. And it became this really strange place to be in. It's like, how am I simultaneously making too much and not enough at the same time? And that put you in the gap. And that was called the health coverage gap. And for years, we had a health coverage gap. So about 70,000 people went uninsured for years because they couldn't afford a $500 premium to purchase a marketplace plan without a tax credit. And so there were several legislative solutions that were being examined for years because it was up to the legislature to close this gap and expand Medicaid. And Idaho Legislature said no. Year after year, we don't want to do it. So it got put to the voters, and it passed as a ballot measure in 2018. And because there were so many years of this being in the spotlight and being in the public's eye as being a real problem, it really had overwhelming support when it passed at the ballot. And so in 2018, we saw 61% vote in favor of expansion. It was also 35 out of 44 counties voted in favor of it. And in 2020, January of 2020 is when it went live. And we saw people finally not be in the gap anymore and were able to access health coverage, many for the first time in years.
And the filling of that gap, it was, as you mentioned, it's largely federal dollars. Idaho didn't have to pick up the payment for all these individuals. Yeah.
Yeah. And actually, before 2020, if we had expanded Medicaid, it was covered at 100% of federal match.
Wow. So fast forward, 2025.
I'll just say that after it passed at the ballot, because I've been around since 2017 working in this area. And when it passed and then it was implemented in 2020, I'm like, this is great. Let's start looking at other areas we can improve our health system. And it just became very quickly clear that every year after, this has been a contentious topic. And so it passed, it's been 7 years since it passed at the ballot and 5 years of implementation. And it still is being talked about and being looked at as being a problem for the state in the state legislature. And
it's primarily because it is an expensive program, just objectively, that healthcare is expensive. And so it's become a target for those who think that maybe there's some cost savings.
Yeah, and I think it would be good to kind of just hit some of these points head on.
Yeah.
So we hear all the time that the cost of expansion exceeded what was projected. And it is true. The costs for expansion have been higher than were anticipated. And there's a couple of reasons for that I think when you put it in context and zoom out, it's really easy to understand why. So when you look back to the original projections that came out of what expansion would cost, it was pre-COVID and all of the things that happened with COVID. Also, Milliman is the actuarial firm that did the analysis. How they have to gauge what their numbers and projections look like, they look to other states similar to Idaho. And so they're making an educated guess based on, well, we know what it costs now for Medicaid. We know what other states are paying. And so we know that there's a behavioral health component need, that people have probably some pent-up demand, and people with serious mental illness and in our behavioral health care system are going to need some assistance. So they made an educated guess. Well, what they could not guess was that the impact of all of the economic turmoil that we went through from 2020 through 2023, 24. And during that time, regardless about how you feel about COVID, we had a pretty significant upheaval during that time. We had record inflation happening. I mean, in 2022, we hit an all-time high in inflation that we'd seen in decades. And so Medicaid expansion was not immune to inflation related to just what was happening in the economy. So there was high inflation, was a big part of it. Additionally, Idaho had about almost a 12% growth in population during that same time. So Idaho population exploded. People coming into the state are not all wealthy individuals moving from California. They're families, they're coming here. There's some level of need for health insurance. On top of that, we also found that the pent-up demand for healthcare was really high. And that was something I don't think was ever able to really fully understand and was really underestimated. The population that came into Medicaid expansion was sicker than anybody anticipated. Additionally, previously, we had no behavioral health care system. Before expansion, it was completely fragmented. And Medicaid expansion was able to cover people with serious mental illness that had been only accessing care in crisis situations.
Sure.
Which was very expensive and covered 100% of the state dollars. So we had about 1 in 3 Idahoans on expansion have a serious mental illness diagnosis. And so a lot of the population coming on had very high healthcare needs, pent-up demand. We had record inflation, population growth, and healthcare costs across the country grew. And so when you factor in all of these aspects, it's easy to see why costs were a little higher than was actually anticipated.
Yeah, and so in response to the costs, what some have referred to as like a runaway budget, their legislation was put forward to say, hey, we're going to get the Medicare expansion issue under control. And on face value, it appears to be one that they say, okay, we're going to put some sideboards on it. We're going to clean it up. We're going to have less fraud. We're going to sort this out. We're going to get this right, and it's going to be cheaper for Idaho taxpayers. And in a economy, an environment where the federal government is making cuts and cleaning everything up, this is just going to be a perfect streamlined way to do it. So a bill was proposed. It passed the House, but you've got some pretty big concerns about the implications of this bill and what would actually happen.
Yeah, so when you look at the bill that has been introduced, it just passed the House on Wednesday. I think that everybody would agree it's always great to look at opportunities to save costs. Mm-hmm. Where can we evaluate where things have gone up quicker? Pharmacy has been a huge it has seen a huge increase over the last couple of years. But the areas that are experiencing growth are not being looked at in this particular piece of legislation. And what is missing from this legislation is, when you look at the piece of legislation, there's nothing in here that really address costs. It's just looking for opportunities to cut people off of Medicaid expansion. Mm-hmm. And on top of that, the bill very specifically has language that says, if we don't do X, Y, and Z listed out in this bill, we're going to repeal Medicaid expansion. And so this bill has 11 conditions that essentially are required to be implemented and approved by the federal government, because every one of these conditions, there's 11 conditions, we have to get federal approval to do them.
Okay.
And so the state has to apply for every one of these conditions. They have to gain federal approval and implement every single one of these provisions by July of next year, or Medicaid expansion will be repealed. And when you start digging into the weeds of each one of these conditions, what really is being lined out is it's really a Medicaid expansion repeal bill.
But they're not billing it as that. It's not. I mean, that's not how it's advertised.
Right.
But you're saying as you get into it, being able to reach all these 11 is impossible.
Yes. And so to kind of break it down a little bit, it's like we're giving the state 11 tests and we're saying you have to pass every single one of them, or we're going to kick 90,000 people off of the program.
Has another state seen success with 11 qualifications that the federal government checks the box on all of them?
So every single one of these are kind of unique in their own way. So the work requirement, let's talk a little bit about that. There have been 13 different states who have submitted a work requirement and gained federal approval. We've only seen one state actually implement them.
Georgia?
Actually, no. And I can get to Georgia in a minute and why Georgia is different than Idaho.
Sure.
So Arkansas implemented a work requirement, but then it got blocked by federal courts, and actually several others got blocked by federal courts. Because actually they failed to meet Medicaid rules that are required under these applications. So the work requirements is one of them that it very well could get approved under a Trump administration. They got approved during the last one. However, every single one of them have gotten held up in federal court. There are other waivers. So their applications are called waivers. Mm-hmm. So you might have heard of that. So there's about, I think, 10 different waivers that have to be submitted. There's an enrollment cap being required to be applied for, and a lifetime limit on the expansion population. So they're saying we want to cap it expansion at 50,000 people, and you can't be on it for more than 3 years. So if you hit a 3-year mark, you're barred from ever accessing Medicaid expansion ever again. And the problem with both of these is other states have attempted them. Both Utah and Arizona have submitted waivers during the Trump administration asking to do these things. And even in the Trump administration, they said, sorry, you don't meet Medicaid rules under these applications, so you can't do them. And the bill very clearly states if even one of these is not approved, we're going to repeal expansion. And there's precedents to show several of these conditions have either been held up in federal court or they've been rejected even during a Trump administration.
So if that's the case, if it looks like, smells like, tastes like a repeal, it might kind of end up as a repeal.
Probably a repeal.
So there are people listening saying, great, sounds expensive, repeal it, get rid of it. So there's 70,000 people right there that would be affected?
So if this bill were to pass and expansion is repealed by next year, by summer of next year, essentially there would be about, I think there's 19,000 people that would qualify for a tax credit on Your Health Idaho.
Sure.
So a subset of people could go on the exchange and get a tax credit to get private coverage. But you have about 70,000 people who suddenly are just pushed back into the coverage gap. They're not suddenly going to qualify for a tax credit. They're not going to qualify for traditional Medicaid. We're pushing them back into a coverage gap that exists that we had for years.
But they won't get sick anymore because they're not on Medicaid, so we won't have to pay any of their costs, right? But really, what happens when they need health care?
Well, back before we had Medicaid expansion, we had a patchwork system to cover those that were indigent. So we had indigent care funds. We had state catastrophic care funds. And those picked up the costs if you had an emergency and you go to the ER and you're uninsured. That's uncompensated care. You can't pay it. It gets pushed out to the counties to cover that, which is covered with taxpayer dollars. Yeah. And then state catastrophic care funds would help pick up some of the cost. And then hospitals also had to write off a part of it. And so they don't just get to say, oh, those are just losses we're going to absorb. No, they increase their healthcare costs, and then it gets shifted to private insurance and increases the cost of private insurance because we have to make up the cost somewhere. It just doesn't disappear. So before expansion, we were paying for it in catastrophic care funds, indigent funds. However, those are gone. The state repealed them at the legislative level because we had expansion.
Right.
This bill doesn't have a plan for if expansion is repealed. There's no replacement plan. There's no plan of, hey, let's bring back the county fund. Let's bring back the state catastrophic care fund. There's no plan. So what we will see is people won't go to the doctor until it's an emergency. They'll go to the ER. Hospitals will have even more uncompensated care that will just get shifted and higher healthcare costs for everybody else. And we'll see higher insurance premiums.
Yeah, Representative Wheeler, who is a self-described nerd, he used the Indiana Jones reference of like jumping out into the dark and hoping that something then catches you.
Exactly.
We're hearing a lot from our rural hospitals, especially, who seem to have concerns that, without an ability to pay for this healthcare service, they won't be able to operate.
Yeah, and I think that's a really good point to recognize that Medicaid is here to stay. It's a very integral part of our healthcare system, our health insurance system, because when you have fewer uninsured people in the state, then we have a way to pay for those healthcare costs. So it keeps healthcare costs down, it keeps private insurance down, and there is a pretty significant economic benefit to Medicaid and Medicaid expansion. And there's been an analysis done. I don't know if you've seen the Peterson report that has come out recently, but there's an economist from University of Idaho that had done a report to look at what is the economic impact of Medicaid expansion. And basically, we get about $1 billion that comes into the state from the feds to cover expansion. And for every $1 in federal funds that we get for Medicaid expansion, it really produces $1.82 in economic activity. And that's essentially, you have a nurse who's in her community over in Caldwell, where she's going to the local store and buying shoes for her kid, buying groceries at the local store. So it's that type of trickle-down effect of the economic activity that we're seeing. But it also produces it's equal to about 93,000 jobs a year.
Wow.
On expansion. And we have about $47 million in tax revenue, with about $12 million of that in property tax revenue.
Wow. And
so when you look at it from the economic standpoint, if we lose expansion, if Medicaid expansion is repealed, we're going to lose 93,000 jobs in our healthcare system. How are rural clinics going to be able to be viable? They're losing their patients. They're losing their healthcare staff. They're already operating on thin margins. They don't have anybody paying for care. We're very likely going to see clinics and rural hospitals have to shut their doors.
Yeah, and what's been interesting to see is there are people who are very opposed to government involved in healthcare, and that's not the conversation here. The conversation is not should the government be funding healthcare or should Medicaid exist, because getting rid of the expansion, like you said, doesn't get rid of traditional Medicaid, and also this isn't something that the healthcare costs don't disappear when the funding disappears. It just gets shifted. And right now, there's no plan. But even in the case that they return indigent funds, am I saying that right?
Yeah.
Yeah. That's a big word for
I know.
Idaho boy.
I know.
The counties, I mean, they've got to find the funding, right?
Absolutely. They are. It's really going to get shifted also to property taxes.
Sure.
Because if you're losing $12 million in property tax revenue, we're going to see property taxes go up for other people because they got to make up revenue somewhere.
But that's a perfect storm because we have a legislature that loves cutting property taxes, and that's been a fun thing for them to be able to return to Idahoans.
Exactly.
And that trend won't be able to continue.
Correct.
Yeah.
It'll be a shift to property taxes. It's not just going to be a shift to private insurance. We're going to see a trickle effect all across the state we're having a pretty significant workforce shortage right now. Right now, if you look at the statistics, we are ranked last for physicians and pediatricians per capita. We're ranked last in the country. We've lost 22% of our OBGYNs between 22 and 23. And if you have a bigger uninsured population, you don't have as many people able to come in. It's just going to shrink that workforce as well. So you're looking at a hit to our property taxes, looking at a hit to general fund revenue coming in, looking at losing workforce, higher uncompensated care, higher health insurance premiums. It's a pretty significant cost.
So to boil it down on its absolute basics, you have people who support the bill who are trying to cut costs. You have people who oppose the bill who, well, I guess it's not that homogenous, but I mean, people want to cut costs. Yeah. It's getting expensive, both for the feds and the states. We've covered the complexities of that. And then you've got people, and this is on the House side, who supported the bill, opposed the bill, cut costs. And then on the other side, it was, they can see the value of it. More importantly, they can see the concerns cutting it. Goes to the Senate. Your job is you're out trying to inform people, having these types of conversations. What do you think happens here?
I think that's a really good question. I don't think that a lot of lawmakers want to see Medicaid expansion repealed. I think that a lot of legislators are interested in real solutions to address growing healthcare costs. And in conversations, when you start having conversations with people, they understand that. And they're unfortunately, it's just this desire to do something quick and do something now. Yeah. And instead of really looking at what are some opportunities to rein in some costs. Let's look at how can we support our families that are struggling? Is it work training? Is it looking how we can support them in different ways instead of just kicking them off of coverage? I think that a lot of conversations still are going to be had, and we're going to see this really play out in the coming weeks on where the Senate is going to go with it. But I really, truly don't think there is a big desire to repeal Medicaid expansion. But it's enough of a cause to have concern because we're kind of playing with fire here. And yes, the big concern is that a lot of this is outside of Idaho's control. We're real big on Idaho solutions, but it won't be an Idaho solution. Right. And this bill essentially says, hey, federal government, we're going to put our Medicaid expansion, our Idaho families, our neighbors, our family, our friends who rely on this program, and we're going to put it in your hands. You federal bureaucrats over in D.C. who are hanging out there wondering if they're going to get one of those federal layoffs and essentially saying it's up to you if we get to keep Medicaid expansion or not. If there was a guarantee that all the waivers could be met, the federal government was able to come in and preemptively say, for sure, this is all going to be okay, do you still have concerns? Well, I would argue then why do we need a trigger? Right. To repeal it? If we're so confident that this is going to happen and we're going to pass all 11 of these tests, then why do we need the trigger language? And that's an important part, is that in there, that really is the doomsday clock, if you will. Correct. It puts Medicaid expansion repeal on autopilot. It kicks it out a year later, and essentially we're going to see tens of thousands of Idahoans just suddenly be uninsured. And there's a lot of questions about that process. No state has done this. Right. No state has gone and looked at their Medicaid expansion population and said, hey, let's roll this back. Interesting. But the sun will come out tomorrow, right? There's a lot of good to be looking forward to. This is good. We want to keep following these issues for those who are looking to tell their senator how they may feel about it. We got a bill number for us? Yeah, so it's House Bill 138. And so we coordinate Idaho Supports Medicaid. It's a big network of individuals who are interested in this issue. And so if people want to know how to get involved or learn more, they can follow us on social media. And I'm happy to connect with people and talk more and get them engaged. But really just reaching out to your senator and explaining the value of Medicaid and how important this issue is really great. Yeah. And even just starting to get involved in the conversation, because it's a big topic of conversation right now. It's an important one. And people like me that want to check out, this is your invitation to ask their questions. Don't be afraid to ask the stupid questions. Absolutely. Because I've been asking them all day. It's complex. It's a complex issue. And so we need more conversations on it. You've been kind to share your expertise in this, and we'll look forward to having you back when we see where this whole thing ends up. Yep. Sounds great. Thanks, Hillarie. Appreciate you. Yeah. Till next time.